I'm John Drew. I'm an expert principal in McKinsey's healthcare practice, working primarily with the NHS public hospitals in the UK and also with hospitals internationally. The topic that I spoke on at the conference was really centred around what it takes to develop a movement for improvement. In other words, how to create real excitement amongst staff for improvement activity and how to make sure that that improvement activity connects with the strategic goals of the organisation. And my experience is that that's not easy to do, but actually if you manage to pull it off, it can be extremely powerful. One of the things that is especially important is to translate the goals of the organisation, which at the moment are often expressed in or come down to closing a financial gap, with what naturally motivates, resonates with and excites staff, which is usually not the financial gap and is more often to do with the patient and improving quality and patient experience and also making it less frustrating for staff to deliver care. Often people working in hospitals have the experience that they have to make up for a lack of process or lack of management practices in the organisation by their own extraordinary effort. In other words, they feel like they're sometimes battling against the organisation to do the right thing for the patient. And if you frame the improvement activity properly and well, it can bring those two things together. So how do you do that? First of all, I would say explicitly address what we would call performance and health and give those equal weighting. So performance means short-term, typically short-term operational performance. It could be the financial outcomes, the operational measures, things in a hospital like theatre productivity or length of stay, as well as clinical outcomes. All of those things constitute performance, and that's usually where organisations focus, certainly at the more senior level. Organisational health, on the other hand, is about the long-term culture of the organisation, what it takes to renew as an organisation, how to create alignment from top to bottom and between departments. Also has to do with things like the quality of relationships and the level of trust in the organisation. Typically that is focused on much less, partly because there isn't an equivalent set of tools and approaches in the same way that those have been developed for operational improvement and measuring performance in that way. We do that within McKinsey by working with our clients using a tool called the Organisational Health Index, which is a way of characterising and measuring the management practices within the organisation, both which management practices are focused on and how effectively they are delivered within the organisation. So that could be, for example, is coordination and control achieved by the financial management processes or through operational management or through professional standards? Those are choices that hospitals can make. Those management practices then drive a set of cultural outcomes which can be measured, and all of that can be summarised into a single score effectively for the strength and health of the organisation's culture. And my experience is that what that does is it gives you a way into a much more robust and focused conversation about the choices that we make, about how those choices affect the culture and the motivation of the workforce, and allow you to start to engage the leadership community, both managers and clinicians, to make sure that those choices are being deliberately made and the management practices that are most important can be strengthened over time. Second thing I would say is that improvement networks are a very powerful model for scaling change and integrating the development of individuals, which might normally be done through training, but we would argue is much more effectively done by integrating capability building with real improvement projects. Networks also bring people together and create a greater sense of excitement and of learning, that people learn from each other, they learn from what different hospitals and sites are doing in a way that often doesn't happen if the practice is just translated either through documentation or if the practice of one hospital goes up in the hierarchy and then comes back down through an instruction. It's much more powerful to hear that directly from a peer. And I think they also create a sense of peer-to-peer accountability, which is different to the regular hierarchical accountability that is how most organisations are run. So those improvement networks, in my experience, can be a very powerful way of building an institutional skill, not just an individual skill, and actually over time creating excitement around improvement. And if the projects are selected carefully, then they can be aligned deliberately to the strategic goals of the organisation. The last thing that I would say that comes out of this is actually a need for leadership development and a different type of leader. So I think that we are seeing a shift from leaders who have and exercise power in organisations, who are expected to make decisions, and for that to be seen to be much more a flow from the top down, to a much more devolved model of leadership, which involves actually trusting teams and staff, trusting clinicians to run their own services, which involves giving them proper data to understand their own services, creating transparency and a delegation of decision-making authority, which at some level is a risk, but in the long run I would say is actually less risky than running a complex organisation without the full engagement of the staff. So I think that's also an important question for organisations, is as you think about creating a movement for improvement, don't just focus on engaging the frontline workforce, but also what does it mean for you as a leader? How does your own behaviour get amplified through the rest of the organisation? How can you be a more effective role model to see the behaviours that you want to see in others? And then a crucial thing also is, what's the story that you're telling about your organisation or your department and where it's going? What's the change narrative which people need to make sense of how all of this fits together and is not just good for the patient and for them as an individual, for their team, but how will this benefit the organisation and make it stronger and healthier over time?